Greetings. My name is Letitia Hensley, and I'm the Charlotte-Mecklenburg Schools Director of Family and Community Engagement. We are excited that you are joining us today and know you will gain great insight from this session. At the conclusion of today's session, please provide feedback so that we can continue to support you with amazing sessions that will be provided throughout the year. Now, without further ado, we'll turn it over to our presenters.
Good afternoon, CMS families. Thank you so much for joining today's Family Academy session, Understanding School Health. Please take a moment to sign in to today's session using the bit.ly on the screen, bit.ly/Family Academy sign in. If you are in need of translation support on today's call, please select Captions in the top right-hand corner of your screen. Then you'll select Show Live Captions. And from there, you'll be able to select the language from the drop-down of your choosing. So once again, please select Captions, Show Live Captions, and from there, you'll be able to select the language of your choosing from the drop-down. And we are excited to engage with you today. If you have any questions during today's sessions, please click on the Q&A feature in the top right-hand corner of your screen. And from there, you'll be able to enter any questions within a text box that will ensure our answer during our question and answer time. And we're excited to engage with you on today's session. So please feel free to send a thumbs up, a clap, a wow emoji for any of those new learning moments or ahas, or anything that just brings you joy and makes you excited about the school year. And at this time, I'm excited to introduce our fabulous CMS School Health team from the Student Wellness and Academic Support Department. We'll have Ms. Treva Johnson presenting and sharing valuable information as we begin our school year.
Thank you so much. I'm excited to come to you to provide some information of how to understand school health as we embark upon this new 2025-2026 school year. Our school health leadership team includes Monica Adamian, the school health manager, and I am Treva Johnson, your school health specialist. Our objective for today is that the school health program is to ensure that every child reaches their best health and allowing them to take full advantage of their education. We know that if a child struggles with their health, it can really hurt their learning experience, causing them to miss school more often and struggle to concentrate due to health problems, which can lead to lower grades. Therefore, it is crucial to focus on student well-being since their health plays a key role in how well they can participate in and benefit from their education. Now, we're going to look at the whole school, whole community, and whole child model, which we call WISC. It was created by the Center for Disease Control, and it provides a detailed approach to improving school health policies and programs. It aims to create an environment where students can succeed both physically and mentally and academically. This model includes 10 key components that schools need to focus on to build a safe and supportive space for students. By tackling these connected areas, schools can help ensure that students are ready to learn and actively engage in their education. Additionally, the WISC model stresses the importance of teamwork among schools, families, and communities, showing that working together is vital for the health and academic achievements of all students. Now, I'm going to highlight a few of these components. For instance, nutrition, environment, and services. One major thing that they do is they support the nutritional needs of students facing chronic health issues such as food allergies and diabetes. Our family engagement department, they motivate families to engage in school programs that foster healthy lifestyles. our social and emotional climate department. They foster a supportive school environment that prioritizes respect, allowing students to feel comfortable reaching out to trusted adults for assistance. Our counseling, psychological, and social services, they monitor and support students facing emotional, behavioral, mental health, or social challenges. And of course, our health services, we focus on empowering students and their families with knowledge to manage chronic conditions, collaborating with outside healthcare professionals. So those key components of the whole school, whole community, whole child model help us to engage in our schools and also talks about the value of the school nurse. School nursing is defined by the National Association of School Nurses as a unique branch of nursing focused on improving students' health, academic success, and future achievements. School nurses play a vital role in promoting healthy development, advocating for safety and well-being, tackling current and potential health challenges, providing case management, and collaborating with different groups to help students and their families manage their health, speak up for themselves, and participate in their education. Now, you may ask yourself, now, what does the school nurse do on a daily basis? Well, we know it's more than just ice and Band-Aids. Our school nurse does a variety of things. They triage student health concerns, they assess physical and emotional issues, they provide primary health care to students and staff, first aid and chronic condition care. They administer medication on a daily and as needed basis. They refer health issues to healthcare providers for further care and treatment as needed. They write emergency and individualized healthcare plans. They provide students with what they need in order to be at school and learning. They teach students to manage their own healthcare concerns, and they act as a liaison between the home and the student's medical provider. Now, that was only just a few items that they do, but they do so much more on a daily basis. Now, when we think about school, our upcoming school year, you may ask yourself, what should we know in order to prepare for a healthy school environment? One of the things is our medication administration form. So as we are preparing for this upcoming school year, we want to ensure that all students who require medication during the school day receive it safely and appropriately. If your child needs to take any prescription or over-the-counter medication at the school, it is essential that the proper medication administration authorization form is completed and submitted to our school nurse before any medication can be administered. So this form must be signed by both you as the parent and your child's healthcare provider. Additionally, all medication must be brought to the nurse in its original label container by an adult. It cannot be delivered by a student, but by an adult. Students are not permitted to carry any medication themselves unless it is authorized by the doctor. Please make sure to submit the necessary paperwork as soon as possible to avoid any delays in your child receiving their medication. Now, if you have any questions or need a copy of the form, you can contact the school office or the nurse directly. Our diabetes and asthma plans. These plans are personalized health strategies that are designed to meet each child's specific medical requirements. They help ensure that children receive the right care, have a clear emergency response plan, and maintain effective communication among families, school staff, and healthcare providers. Parents should update these care plans every year or whenever there are changes in their child's health. It is also important to provide all necessary medications and equipment and to inform the school about any updates regarding the child's condition or treatment. Collaborating with school health staff is essential for both routine and emergency care. Now, when we talk about our children's immunization records, we need to know that it is the law. It is important to review student immunization records and confirm that they fulfill the necessary requirements before the school year begins. Kids won't be allowed to enroll unless they provide an immunization record and have their vaccinations current. The school needs to inform parents or the guardians or any caregiver that they have 30 days from the child's first day to submit the necessary up-to-date immunization records. If the child's vaccinations are not current, they must be completed within that same 30-day time frame. After the 30 days are up, any child who does not have a certificate of immunization proving they received the required vaccines will not be allowed to attend school until they provide the necessary documentation or show that they have started the vaccination process. So North Carolina requires this. So this is a North Carolina law, not a CMS law, that every child in the state gets certain vaccinations. When a child enrolls in school or child care, their immunization records are checked, and it is responsibility of the parent or guardian to make sure that the child gets their required shots. It is important to review the student immunization records and confirm that they are fulfilled before the school year begins. Kids won't be allowed to enroll unless the provided immunization record and their vaccinations are current. So the first day of school is Monday, August the 25th. The 30th day is Tuesday, September the 23rd. And exclusion day is Wednesday, September the 24th. So that means all immunization and health assessment records must be sent to the school by September the 23rd. If not, on September the 24th, they will not be able to return to school until those health records are updated. The county has developed a helpful resource guide, and it lists providers in the area that offer affordable services to school-aged children in the community. You can find this resource guide on our school webpage. Too sick for school. It's common for kids to get sick occasionally, but parents often wonder when it's best to keep them home. So we have created an infographic called Too Sick for School that offers a helpful guideline for parents to decide when their child should stay home. These guidelines aim to stop the spread of contagious illnesses. So when a student is unwell, they can't learn properly or engage in class activities. I definitely urge families to take the right actions to ensure that if a student is sick, that they should stay home to protect their classmates from getting ill. So you may ask yourself, how can parents report an absence when a student is sick? Now, if a student is sick or will be absent from school, there are ways that you can get in contact with the school to let them know that your child will be out of school for that day. You can always call the school and let them know. You can also send an email, or you can use the absent form that is usually the icon that is on the website. Now we're going to talk about our school-based virtual healthcare clinics that are in some of our schools. Meaningful Medicine is a collaboration between CMS and Atrium Health with financial backing from Bank of America. The initiative provides various services, including school-based virtual healthcare, school-based teletherapy, healthcare workforce development, community health workers, and community-based virtual primary care. CMS operates virtual healthcare clinics in 112 schools. This allows students and staff to have virtual consultations during the school hours. This arrangement helps 6 students receive prompt medical attention, and enables them to return to class quickly if they start feeling better. Our virtual on-the-campus healthcare is only for acute, episodic, and chronic non-emergent medical needs. Some of the common illnesses treated are allergies, head lice, asthma, stomach aches, headaches, coughs and colds, pink eye, ear pain, sore throat, rash, flu symptoms, and fevers. Clinical services provide help for sudden health issues and ongoing medical problems that aren't emergencies. They also include testing and collecting samples when necessary. Additionally, doctors can send prescriptions electronically to the pharmacy. That is easiest for the patient and for their families in this process. So how does it work? With the parents' consent, a medical professional arrives at the school to connect to a virtual provider. Parents will be invited to join the visit by phone or video. During the visit, the virtual provider performs a physical examination. They use special equipment to look at your child's heart, lungs, ears, and throat all over the video. The virtual provider diagnoses your child's condition and offers a treatment plan. They can also order prescriptions if needed. If your child's condition is minor and non-contagious, you can both return to your day without leaving school or work. With your permission, Atrium will send notes from your child's visit to their primary care doctor. And if they don't have a doctor, Atrium can help them find one. Now we're going to take a look at a quick video that shows how the clinic truly works.
I received a call from my child's school that she was not feeling well. She was having a sore throat and an ear pain.
We check their vital signs, ask them what's wrong. One of the goals as a school nurse is to keep all of my students in school and healthy.
As a full-time working mom, it is hard to get off work at the last minute notice.
School-based virtual care has the potential to really affect a student's grades and their attendance. A lot of times that student can be seen that day for that problem and not even miss a day of school. The turnaround time for their illness is usually much quicker.
School-based virtual care is to keep kids really where they need to be. And to do that, we need to be able to offer medical services within the schools themselves. And that's what our program allows.
They offered me the opportunity to take part of the virtual care experience. During the virtual experience, the Levine Children's provider was very comforted and caring for my child. That means a lot to me. I saw everything going on in real time, and I knew my child was in great hands. At the end of the virtual visit, we had a diagnosis and we had a treatment plan.
The parents are able to participate just like they would be if they were in an office here. So even though you're separated by many miles, it feels as though you're sitting in an exam room. Families can be involved and there can be minimal disruptions to both the child's and the parent's life.
As a full-time working parent, this is a great opportunity for our community to be able to utilize this resource moving forward.
The school-based virtual care process is very straightforward. It starts with the kid expressing that they don't feel well, usually telling their teacher, who then refers them to the school nurse. The school nurse then does their own independent assessment to determine if they feel our services are needed. They reach out to consent and ask the parents if it's okay for them to use our services, and to also ask if they'd like to be involved in the visit remotely. After that, a telepresenter is deployed to the school. When the provider is ready, they join the virtual visit and the telepresenter activates the device that is used. This device allows us to see high-resolution images of the eyes, inside the mouth, also inside the ears, and then to also listen to heart and lung sounds. After the visit is completed with the provider, a care plan is established. And if that involves prescribing antibiotics, they can be sent to the pharmacy. if that involves needing to be dismissed from school because they're considered contagious. The big takeaway is that if they're considered not contagious, they can be safely sent back to the classroom with minimal interruption to the child's life and to the parent's life.
So it's a wonderful resources in some of our CMS schools. So some questions that are often asked: is this resource available to parents on campus? So unfortunately, no, it is only open to school staff and students. But Atrium does provide virtual clinics at places like the YMCA for people in the community. Now there you can find a flyer for community-based sites by scanning the QR code at the bottom of this screen. Is there a copay? Payments are not taken at the school. You will receive a bill after the service. Atrium accepts Medicaid and insurance, and there is financial help available for those without insurance. So it's best to always talk to the Atrium staff if there are any financial constraints. And does my student's school have a virtual clinic? The QR code that we have listed at the bottom of the screen lists all of the CMS schools that are participating with the clinic. But you can also contact your school principal, the nurse, or the front office to inquire if the school-based virtual care is available at your school. We also have it listed on our CMS website under School Health and Wellness, and you can also see signage at the schools if the school-based virtual clinic is available at your school. Again, additional information on school-based virtual clinic, the community clinic, and the financial assistance program, and the list of schools can be found at this QR code. If you have your phone out and you're following us on a laptop or a computer, you can follow us on Facebook to stay connected with school health events and resources. We try to put up-to-date events like our Big Shot Clinic that the county is doing in September to advertise that for some of our community partners. It's a good way to stay connected with the CMS School Health. We can answer any questions. You can also follow us and become our friend. If you have any questions, my contact information is on the screen. We are more than welcome to answer any questions, to provide you any insight when it comes to CMS School Health, because remember, there's endless possibilities when it comes to CMS schools. Thank you.
Thank you so much, Treva, for sharing such valuable information to our families. We do have a request in the Q&A if you could go back to your QR codes to scan quickly.
Sure, I'll do the Meaningful Medicine Family Resource one first.
And families, I do have the slide deck added to the Q&A as well. Feel free to please access and follow any of those links as needed.
And then I'll go to our Facebook page. We definitely want our parents to follow us to get the valuable information that we share out with the community. And you can always also reach out to us through Let's Talk, the Let's Talk app as well.
Thank you so much. Families, at this time, we do not have any additional questions within the Q&A. Please make sure that you've signed into today's sessions to stay in the loop of all future Family Academy sessions. If you have any additional questions, please feel free to reach out via Let's Talk or using Treva Johnson's email that is shared within the slide deck. We hope that everyone has a safe and successful start to your school year. Thank you for attending CMS Family Academy. Have a wonderful day.